kindly let us talk about this thing here called eczema or atopic dermatitis. So I urge you, please stick to the end of the video because that's where the treatment is. Okay, but before you treat, you need to understand what is happening with this condition called eczema. It is amongst the most requested topics with parents and caregivers of children who are going through eczema. Okay, so stick around and please subscribe for more of this and other useful videos. So number one, whenever you hear about this word being mentioned in medicine, gastritis, appendicitis, tonsillitis, you see this common TIS, all these normally denote an inflammation. An inflammation is just a body's response to an intruder. That intruder can be a physical object, can be bacteria, can be viruses, can be fungi. It can even be the body's own confusion, and so it starts attacking its own cells. But basically, it means that there is an inflammation going on. What is inflammation? Inflammation is that process where the body initiates a response towards an intruder. Once that response has been initiated, we get the following symptoms: pain, redness, swelling, and because there is pain and there is swelling, you end up with loss of function. These are basically what we normally call, the triad or, cardinal signs of inflammation. So what does it mean? It means that here we are talking about inflammation of the skin. Of the skin. So the skin will present with these symptoms. There will be pain and irritation. So, because now we've understood this bit, so we're coming now to dermatitis, and you're saying that it is an inflammation. This is an inflammation. And whatever it's here, this is the medical term for skin. So it is an inflammation of the skin. And usually we are talking about the upper layers of the skin. I won't go into the medical terms. Of course, there is, the other medical terms that are going to be difficult for you to understand. But just understand that it is an inflammation of the upper layers of the skin. And because we have these cardinal signs of inflammation, the skin will have the following symptoms. We'll have a rash, plus pain, plus irritation. That's number one. Then we'll have a skin that is red. That's number two. Then we'll have a skin that is swollen. When it is swollen, it becomes thick. It becomes rubbery and almost becomes leathery. And then now the skin will lose its function. What is the function of the skin? It is a barrier to infection. How will it lose the function? It will lose the function because the skin will also become dry and it will also have cracks. Because of the dryness and the cracks, it is very easy for fungi plus bacteria to get under the skin. Then you end up with skin infections. And these infections, somehow, they get access to the bloodstream, and you have a child who is constantly in the hospital because of an infection or another. So we are saying the symptoms, what you are going to see on the skin of that child: rash, irritation, itchiness, red skin, it will become swollen, it will become dry, and it will have cracks. Where does it begin? It begins here. It begins with one or both parents who have an issue with allergy or allergic medical conditions. This starts from nasal blockage, sneezing, coughs, especially at night. Anybody who has ever used an inhaler or nebulization, the one that is done in the hospital, anybody who has issues with gastritis or heartburn, anybody who has allergy to meds, allergy to medication, you've ever reacted to medicine, or allergy to proteins. Now, if you have one or both parents with all these conditions, or either, they are likely to have an offspring who will also present with allergic conditions, and one of the allergic conditions is eczema. So it starts from the genetic makeup that they inherit from the parents. How does it begin? We have allergic parents who are allergic, or in common terms in medicine, we call it atopy. Atopy is simply mtu mwenye ako sensitive, anangoja tu kureact na kitu, anangoja tu dust, ama smoke, ama perfume, ama paint, ama flu. Anaanza kujikuna masikio, anafanya hivi, anajikuna macho, kona rash, anafanya, okay? Those kind of things. Sawa sawa. So, when these people get a child, one of both parents has this, and you have a newborn. Let's start from the newborn period. Newborn. It starts with nasal blockage. As soon as the child is born, amezaliwa tu hivi, and the child has taken its first breath, whatever is in this air, and they inhale it, it starts from the nasal blockage. So the child gets blocked and even refuses to breastfeed. The treatment that is given then, nasal drops. In fact, wanasemanga ati mtoto amepata homa, lakini si homa. Nasal drops, it improves the situation and they start breastfeeding. This is the newborn. Months later, they come with eczema. Where does it start from? The cheeks. Huku kwa mashavu. It becomes red, it gets swollen, and it gets cracks. It almost looks like tiles. Then it manifests to other areas. The limbs, the stomach, the back, and then they also get a diaper rash. If you change the diaper that they are used to, or you change the wipes, or you leave the child soiled for long. Then, where they're still months later into becoming an infant, approaching 1 year, they get wheezing. Wheezing ni kufungana kifua. So they require nebulization. And some of them are even put on inhalers. Then later on, they start getting issues with gastritis. That is heartburn. And increased levels of acid, and they start presenting with abdominal pain. They don't want to feed, they might start vomiting. How does the skin look? Again, any child who presents with the following symptoms on the skin is a child who is dealing with eczema. patches, rashes, dry skin. Hii hata ukipaka mafuta bado skin inakaa kuparara. Cracks, itching. Sometimes they itch until the skin is just full of lines. Then it might have some wounds. You might deal with pus under the skin. They are also prone to getting ringworms, mashilingi. When they get the cheeks, the eczema starting on the cheeks, please don't be misinformed. That is not a reaction to milk spilling on the baby while breastfeeding. Sio maziwa imemwagikia. Sawa. I don't want to get deeper into that because how can your own breast milk, wewe inakuacha kama uko sawa, haikuumizi. Na inaenda kwa ulimi ya mtoto, haimchipui ulimi na kwa mashavu ndani. It doesn't hurt those areas. Inamuumiza tu kwa cheeks peke yake. That is a misconception and that's a myth and it's not useful for us. So what are you supposed to do when you have a child who has eczema? This is a child that needs to be treated in the hospital, seen by a medic or a specialist who is a dermatologist. Now, start treatment early enough. Early treatment while they are still young and as soon as you notice those symptoms. And the reason I'm saying early is because we've said that the skin becomes thick, it becomes rubbery, and it becomes leathery. And with the scratches called excoriation and the wounds, and so it changes the picture. As the child is growing older, it changes the picture and it does not typically look like eczema. It looks like a fungal infection, looks like a bacterial infection, it looks something else. So it becomes very hard to restore that skin back to how it was. So start treatment early, while the child is still weeks or months old, to prevent these changes in the skin. Because while the skin changes and becomes thick and becomes rubbery, it becomes so hard to restore that skin back to how it was supposed to be. Now let us address the methods that we normally use. We have moisturizers. The work of moisturizers is just to keep the skin moist, to prevent dryness, to prevent cracking, and to prevent the eczema from spreading to other parts. But it doesn't treat. It only keeps the skin moist. We know them. We know Epimax, Epimol, all those things. Aqueous cream. And I know you are very familiar with those names. It only keeps the skin moist and doesn't treat anything and prevents the other areas from getting infected. Whenever there is a flare-up, that child will require treatment. Because one characteristic of eczema is that there's this pattern of going, coming back, resurfacing, disappearing, that kind of pattern. So whenever the eczema is back, the symptoms are there, it will require treatment. Once that flare-up has disappeared, then you continue with your moisturizers to moisten the skin. Okay? Avoid unprescribed products. Avoid unprescribed products. I'm talking about milking jelly or milking creams or milking hizo mafuta za kukamua ng'ombe, Arimis and the like. Please don't use them. Because we are talking about a skin that is sensitive. So you might use a product on the skin and it actually flares up the eczema and damages the skin further. Have we understood? Yes, we have. So what are we saying? We are saying here that the first thing that you need to do is to identify that this is eczema that you are dealing with, and then seek treatment. Okay? At first care, offer treatment for eczema, and we've treated it successfully. And I normally see that the child will require treatment for about the first 2 years or so. After that, the skin has already hardened, and it's not likely that the child will be suffering from eczema anymore. So treatment might involve that prolonged period because eczema is a chronic condition. You might start treating from the child being months old, 2-3 months, sometimes even 1 month old, and you might continue the treatment for up to 2 years. And then, while you're still doing your treatment, you also need to avoid triggers such as perfumed soaps, salty water, all those things that you will come to be advised upon treatment. So what other issues is eczema associated with? Eczema, as we've said, is associated with gastritis, will be associated with the nasal blockage, will also be associated with iodine hypertrophy of the tonsils, and issues with reaction to medication and reaction to proteins. Okay, so I hope this is clear, and it's not just about experimenting the treatment for eczema. It is not about sitting in agony and asking yourself what is wrong or where can I go for treatment. It is just identifying that this is eczema and this is something that requires to be treated by a specialist or somebody who is familiar with what is happening, and start the treatment early enough to avoid the thickening and the skin modifying to an extent that is going to be harder to treat and to recover. Okay, so please subscribe to the channel so that we are able to learn. I'll be posting other medical conditions as we go on, and I think the next thing that I'm going to deal with will be on newborn care. We are talking about a child who is 0 to 1 month old. There are normal issues here that require to be addressed. There's feeding, there's cord care, there is everything, washing the baby. So please subscribe, okay?